Welcome, John. We've got Dr. John Davis with us today. Very honoured to have you here. You're a local celebrity and identity. I'll
Oh,
let you I'll let you introduce yourself, John, and tell us a bit about yourself.
my name's John Davis. I live in Wangaratta in northeast Victoria. I'm here. Well, what I've done quite a few things. I'm now 78 years old, and I'll say that right at the beginning. And I've been an Anglican priest for 45 years. I'm currently serving on the Australian Department of Health and Aged Care Council of Elders, which is a really significant policy shaping body potentially. Certainly, it is a body for advice to government and to the department in areas of health and aged care, and we had quite a bit to do with the development of the new Aged Care Reform Act. So that was a very significant thing to be part of. And of course, included in that are things that directly relate to the rights of older people. It mentions palliative care specifically in the Act. So in terms of dealing with those sorts of issues, and with a values base behind it, and a person-centered approach built into the whole system. The problem there is working out where aspiration meets actuality. So we go quite a long way before we get to where we absolutely want to be. But this is the way we need to go. Yes. So I'm involved in a lot of that in my retirement, and a number of other related areas of participation and service that I'm really happy to offer. But I'm coming into the particular field of death and dying, both from my experience as a priest and also from my experience as a carer for a partner who did die, and was wonderfully well supported in palliative care.
Mm. Yes, it's interesting that you talk about aspirational ideals. We do have to, shoot for the stars and see how far we get. But it is
and
interesting.
Also work out what is possible.
Yeah.
Yes.
But I'm very glad that that all the literature mentions palliative care, because as we know, palliative care is core business in aged care.
Yes,
So
yes.
it's absolutely vital that it
Well, we're all going to get
plays
there
a
one
pivotal
day.
role. Yeah. Well,
Well,
we hope so.
hopefully.
That's
Yes,
right.
yes.
Yeah, so thank you. And thank you for joining us. It's really wonderful to have you here. Um, so over your time as an Anglican priest, uh, I'm sure you've had a lot of challenging conversations, and had to bring all of your skills to bear around good communication and trying to sort of negotiate through difficult situations. I would wonder if you'd just like to have a bit of a chat about that. And
I think good communication at depth in times of profound crisis or challenge is obviously fundamental. Uh, Many people don't have the words or the experience to move in this territory, but it is holy ground. Metaphorically speaking, you take your shoes off before you enter it. You really do. It is so tenderly special that the clinicians and other people entering into this space do it with compassion and integrity and sensitivity, with absolutely every antenna you can possibly have to work out what is going to be the most appropriate way of communicating with either the person who is very ill, or the people who are supporting them, because sometimes they are very different sets of issues.
Mm.
Very different sets of issues, as you would well know, Rose, from
Mm.
all the work that you've done. So I think, yes, compassion, sensitivity, care, stepping carefully, because just because you, as a clinician or a person who's familiar with this space, but just because you're comfortable talking like that, or introducing those subjects like death, for instance, and how one might die,
Mm.
just because you're at ease with it, it doesn't mean that they are. And quite often you're dealing with people who've never dealt with this before. I mean, I had somebody very close to me say, "Well, I haven't died before, so I don't quite know. I don't quite know what to make of it." But I think various people and various clinicians have different responsibilities and different accountabilities.
Mm.
Some doctors are very careful not to answer the questions, well, how long have I got, or any of those sorts of things, and simply refuse to satisfy some very basic inquiries that people might quite reasonably have. So
Mm.
that can be very frustrating. It's often the nurses that are going to be much better at this than the doctors. I would make that point. But so far as, for instance, the role of a priest is concerned, well, it's almost expected that you already have permission to move into that territory, and in fact, if you don't, you're not doing your job.
Mm.
So we hopefully we would have the skills, we would have the experience, we would know the processes, and the sorts of questions that people might ask about, what is due process, what is going to happen, who should I be talking to, even which is the best undertaker in the area, or funeral director as they would like to be called these days. To deal with. What is your experience? They ask, and if you're invited and given permission to be honest, that is liberating. That
Yes.
is liberating, because so much of the fear comes from the unknown,
Mm.
and the road not travelled.
Yeah, yeah.
Yes.
Oh, I love what you said. There's a couple of things in there. I love what you said about being sacred ground. I really believe that that's true. I think we enter into these spaces with our patients or our residents. Um, it's a very holy place and a very privileged place to walk around in. Uh,
Yes.
and we do need to revere it and really respect the other person's autonomy and who they are and the fact that they've allowed us to be in this space. And the other thing that you said about the doctors are the ones that often veer away or are reluctant to speak about time limits and things like that. But yeah, one thing I'm always banging on about is that as nurses or as healthcare workers who are caring for the person on a day-to-day level, we're the ones that stand in that space, and we
Yes.
do
Yes.
have the responsibility to actually uh, lead the family and lead the resident or the patient into that space with us. They're looking to us to sort of say,
Gently and lovingly.
"Hmm."
Yes.
Yeah, so they're looking to us to say, oh, this is probably what's going to happen now, or do you want to know more? Or yeah, we've seen this all the time. This is normal, whatever it is. And if we abdicate
Allay some of the fear.
authority, yeah,
To allay some of the fear.
yeah, yeah, that unknown, as
It's
you
not
said,
going to change the outcome, but the journey towards that outcome can be so very different
yeah.
in terms of quality.
Yes, yeah, and as I always say, from Dame Cicely Saunders, the
Oh, yes, yes,
grandmother of palliative care,
absolutely.
the way people die lives on in the hearts and minds of those who love them, and if we can,
Forever,
yeah,
forever.
doesn't it? And if
Mm.
we can make that better for family members and give that whole experience something positive and meaningful and rich, I think that's just so important, isn't it?
Yes, and it's a team. It's a team job.
Yes.
All the people involved in the care and contact and support of a person who's becoming increasingly frail, all of them are part of a team. All of them have
Yes.
roles to play. And they
Yeah.
should be complementary, not adversarial, of course.
Yes, and yeah, communication is so important in keeping everybody on the same page
Yes.
and giving people the information they want and not hitting them over the head with stuff they don't want to know. You know, it's a real dance, isn't it? Very,
Allowing for their agency.
yeah.
I'm thinking of the person who is actually at the centre of all this.
Mm.
Their agency must be respected. And if
Yes.
they say, I absolutely don't want to talk about any of this at all, but I just want to know that you're going to be around to support me and those I love, that might be enough. That might
Yeah.
be enough.
I certainly had that experience with a very dear friend of mine who was told, after, 2.5 years of uh, chemo and all those sort of things,
Mm-hmm.
she was told that, the treatment wasn't working anymore and that there was nothing more that they could offer her treatment wise. And she just would not go there. She just wouldn't. She just kept on saying, "No, I'm not going to die," even though everything she was doing was telling me a different thing.
Yes,
And it
yes,
was a real challenge for me. Because, I had this idea that, we can have these meaningful conversations and talk about death and, the meaning of life and have these wonderful sort of poignant moments between dear friends. And she just would not entertain any of that. I'm sure in her mind, internally, she knew what was going on, but it was such a challenge for me to, as certainly in my role, as a
yes.
palliative care nurse, and nursing for so many years, to hang back and just let her lead the way and just
Yes,
go
but
along with whatever she
ultimately
wanted.
we must do, and that's something else that clinicians and carers and all sorts of people have to take on board.
Mm, yeah,
Yes,
and that's part of the challenge of communication, isn't it? It's like
it is.
uh, meeting people where they're at,
Yes,
and starting from there. Yeah.
yes,
Mm.
and maybe gently moving them on from that space,
Yeah.
but doing it with the utmost sensitivity, because we're dealing with very great vulnerability, and as I said before, potentially great fear. Although some people do not approach
No.
uh, this with fear. In my experience, people are more afraid of the process of dying rather than being dead.
Yes. Yes, that's right. They're just, because there has been all this talk about how painful it's going to be or what it's going to look like
Mm-hmm.
losing
Yes,
control. Yeah. So,
yes.
so over your time, all those years that you've spent dealing with people and having these conversations, is there any time that you really put your foot in it? Like, what sort of big lesson did you learn at some point? You sort of thought, oh, I really.
You've got to do basic things like have the names right. You really do. If you, I mean, that's of course that would of course be fundamentally appalling in a funeral itself, and I have heard that has happened. I don't think I've ever done that. If I have, I think I would have noticed. But that would be terrible. In other words, you have to treat the individual. You have to be in contact and engaging with the individual, and getting the names right is a fairly basic
Yeah.
first point. I think it. I think it is to do with attention to detail and focus.
Mm.
And if one as a worker or anything else is extraordinarily busy, extraordinarily tired, working extra shifts and all sorts of things, you can miss some of the details that you really need to keep on top of. And any mistakes that I've made have been in the area of losing that focus on detail and
Yeah.
keeping the blinkers on in that regard, because you can do silly things when you're not taking sufficient careful notice. You might miss a key indicator. You might miss a key phrase, or you might miss the indication of a key area that is a lack of knowledge, that they're in their own roundabout way saying, "Tell me more," or they might even be saying, "Tell me less." But you need to be completely on the ball as the person interacting, I think. So
Yeah.
attention to detail,
Mm.
because otherwise you can make silly mistakes, and sometimes they don't really matter, but other times they might.
Yeah, and I think the consequences of that, uh, particularly in that respect, if you get something wrong, it sort of tells the person that you're not paying attention, that you're not seeing them, and
Yes, or you don't particularly care about them. They're
yeah,
just another cog in the wheel. Yes. So I
so
think
then
that's
they
that's the
withdraw.
most important thing. Uh, Sometimes people say when they're talking of famous people interacting with them that they made me feel like I was the only person of any consequence that
Mm,
they were having to deal with, even though they were dealing with dozens or hundreds or whatever.
yes,
I think to give people, this is not being false. This is being focused.
yeah,
To give people the sense that you are the centre of their particular care and attention at that particular
mm,
time, and that might be a professional awareness or a personal awareness.
yeah. No, I think it Maya Angelou who said something like, people will forget what you said and what you did, but they'll always remember how they made you feel.
That is absolutely true, isn't it? You
Yeah,
you you
it doesn't.
forget what was said, but you
That's
don't
right.
forget how it was
Yes, you can
said.
say all the wrong things and do the wrong things, but if they know that you are truly there, caring for them, and you want the best for them, or you want to do the best for them, then
And
that's what.
that's why we in the caring professions are where we are,
Mm.
because we're those sorts of people. I,
Yes,
I do
thankfully.
hope so.
Yes, that's right.
And those who aren't really should look for other alternatives.
Yeah. Yeah. So, our
Hopefully.
next question generally is about the tried and true tools. So, you've already alluded to being really focused. Is there anything else that you can think of that you would say if you're going to do communication well, you must do these things?
You must be clear and direct. You must be honest. Uh, you must be respectful. You must be aware of the circumstances of the person you are actually engaging with, and what equipment they bring to this conversation.
So, I
Uh,
guess it takes a bit of homework then, doesn't it?
yes, it does. Yes,
Yeah.
it does. And the sensitivity that comes from professional engagement over a long time sure helps.
Mm,
It
yeah.
does. It does. It does.
Uh, was there anything in particular for your personal experience with caring that you can call to mind? I'll put you on the spot here. That worked or didn't work during that time for you?
I'm thinking in particular of the role of some of the palliative care nurses that came our way. Uh, it was simply so good. I mean, I've been talking before about uh, how somebody who's entering into territory that they're not so terribly familiar finds it really, really helpful to be with somebody uh, who does this all the time, but does it very well and helps to uh, name and address and identify uh, things that might very importantly be engaged with at about this stage of where we are. And speaking out of their experience and speaking ever so gently into the knowledge of the process of what is clearly from their professional point of view going on, but the person or the people themselves are not so aware of.
Yeah,
And you
yeah.
can gently help people along the journey. You
Mm.
you can do
Yeah.
it.
And I think it probably now I'm just reflecting on what that takes, say, for us in the team, is that we talk together, we discuss all the patients that we have
Yes,
together as a team, and
yes,
so we share our combined knowledge of that person, and come up with some kind of a plan. We're sort of
yes,
constantly changing the plan, but an approach. We might sort of say, oh, I think this might be happening with that person. And so all of our shared knowledge gets pooled. And so then we get a clearer picture of the person. And
yes,
then we can go and sort of that can direct us to, for example, to say, next time we go out and see them, we might start asking these kind of questions.
yes,
And I
yes,
guess in an aged care environment, that helps too. Like I guess if someone seems to be approaching the end of life, they're deteriorating, things are changing for them, then that's the time as a team to come together regularly to discuss how they're going, pool all your resources and the shared knowledge between you, and keep on updating the plan and sort of seeing what's best for the family and for that person. What do we need? How sort of directive do we need to be? Is everybody on
Yes,
the same page? You know, what's going on with the family? And so I
all
think,
of that, all
yeah.
of that, all of that. And that was our experience.
Mm,
And that's why I'm an advocate for PAL care these days.
yeah. 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 When it's done well, it's great. And it's such a pleasure to work with the team in Wangaratta.
Absolutely,
Very,
absolutely.
very
Yeah.
lucky. Mm. So the only other thing that we usually ask is what's the one thing you wish people knew about communication, given our audience is dominantly aged care workers in an aged care environment? Um,
Just let it be clear and honest
mm,
and caring.
sounds great.
That'll
Yeah,
do. That'll do.
yeah. I think bringing our authenticity and
Yes,
being human, you know, being willing to be ourselves. Um, and you know, if there's things
the
you don't
best
know,
thing we
then
can
say you don't.
bring. It's the
Yeah.
best thing we can bring.
Mm, yeah.
Yes.
All right, John. Well, look, it's been absolutely lovely speaking to you today. Thank you so
Thank you.
much for your time. I really appreciate it. And thank you for everything you're doing for aged care across the state. We really appreciate it.
Thank you very much indeed. Thank you,
Thanks,
Rose.
John. Bye-bye.